My name is Jennifer Kurtanis, and I'm the director of the Farmington Valley Health District, and your host today for Health Matters, a program produced by the Farmington Valley Health District to provide information on health and wellness. Today, we are going to talk about mental health and wellness, the role of our communities in supporting good mental health, and an initiative started by the Farmington Valley Health District to work with a population of particular risk for mental illness. There's a lot of misinformation and stigma associated with mental illness, and this often can lead people to being frightened to seek help and to ask for care and feel that they may be judged when asking for that care. Recognizing the link between mental health and physical health, the Farmington Valley Health District has made promoting good mental health and wellness a priority. Resilience Grows Here is an initiative of the Farmington Valley Health District specifically focused on veterans, active duty service members, and their family members, recognizing the unique and complex challenges faced by our veterans and our active duty military. Resilience Grows Here is funded by a grant through the Movember Foundation and supported by the Prevention Institute. The goals of the program include promoting good mental health and wellness, improving access to services for those that seek help, connecting veterans to peers to promote good mental health and wellness, and building family supports to promote alternative approaches to dealing with mental health challenges. Today, we are very fortunate to have two special guests with us. We have Jim Hayden, who is the first selectman for the town of East Granby, who has been the host site for the Resilience Grows Here initiative, and Linda McEwen, who is the director of psychological services at the 103rd Air Wing in East Granby. So welcome to you both. Thank you for being here.
Pleasure being here.
Thank you. So, Linda, public health always seeks to protect those that are most at risk of illness, and mental health is no different. As a mental health professional, can you tell us a little bit about why we're seeing more mental health issues emerging in our communities?
Well, certainly I think that there's a number of reasons for that. I think that as a society, as much as we're more cyber connected, we are less personally connected, and that's certainly a factor. Stress is always mounting, and there's always some new information that we learn about, and then that can become like a goal that we're striving toward, or the shoulds in our lives seem to be increasing day by day. So I would say that those are the things that are fueling it, some of the things.
Yeah, I mean, you bring up the issue of social connectivity, and we really, as a society, have changed quite a bit, in part because of social media. We all have our phones, we're texting rather than having conversation, and I think we are seeing that manifest into feeling a little bit more isolated, not connected, maybe supporting feelings of depression, or just not having the support maybe that you need in a real connected way.
Yeah, and we've all had the experience nowadays of going into a restaurant and maybe seeing a whole family kind of looking at their phones as opposed to, interacting with one another.
Right.
And it's clearly not the same thing, and we're not taking advantage of the connections that are directly in front of us.
So are there populations that are at greater risk of experiencing mental health challenges? I certainly mentioned in the opening the veteran population as being one that we're more concerned about.
Yeah, the veteran population is definitely one that we are working intensely trying to mitigate factors that might lead to mental illness, may also lead to certainly suicide, which we are trying to clearly prevent. Other populations, really it remains that one in 1 in 25 people have or 1 in 5 people develop any form of a mental illness currently nationally, and 1 in 25 have a serious mental illness. There are issues with access to care as the health system changes and changes again and again. And certainly, the more stressful your circumstances, the more you may experience some type of psychiatric symptom.
Yeah, you mentioned the prevalence and how actually common it is that in our lifetime, just by virtue of being human beings, you know, we do experience highs and lows and depression, but yet the stigma associated with having a mental health issue, be that depression or a clinically diagnosed mental illness, it's just a little surprise. It's unfortunate to me that as prevalent as it is, we don't embrace and treat it the same way we do, you know, someone who might have a cancer diagnosis or diabetes diagnosis, where you embrace that person, you wrap your arms around their family. And we really, I think, as a society, need to move in a direction where we break down that stigma and support each other. Because if we're all honest, at some point in time, we've all dealt with some depression or feeling the blues or feeling disconnected or down about some circumstance in our life. So we should all recognize that it unfortunately is common, but there are things that we can do to support each other in that.
Definitely.
Jim, you know, recognizing that we're seeing more people and families experiencing mental health challenges, you know, East Granby has certainly prioritized mental health and supported the work that we've been doing through the health department. Why do you feel it's so important for communities to begin to address this issue, and what are some of the benefits of doing so?
Well, there's certainly a tremendous need out there when you start to listen to folks through social services or through senior services or through our education system, of which we're very connected with all three areas. And it's a need out there, and you mentioned stigma, and it's a situation where folks, if you had a broken arm, you're going to get the cast on your arm. If you require some assistance because from a mental health professional because of some life situation that you're going through, well then I think it's something that our communities, in this particular case East Granby, has a responsibility to provide. And we can't, you know, we're a small town, don't have a lot of resources, but through partnerships with Farmington Valley Health District, and in this specific case with Resilience Grows Here, we're able to put a spotlight on the issue, and we're able to allow our residents, and you know, and when I'm talking residents, it's the Farmington Valley Health District towns, our residents to know, hey, it's okay to have feelings like this, that perhaps listening to a TV show, listening to the outreach, maybe I can have a very confidential one-on-one conversation with somebody that will help point me in the right direction. And certainly the other really significant thing is there's 1,000 folks from the Air National Guard that go into East Granby because of the Air National Guard bases in East Granby. And when we realized that there was things that we could do to assist our veterans and our service folks, I felt a moral obligation to do so.
That's wonderful. We need more leadership like yours in municipalities really taking on the mental health mantle. You mentioned the stigma, and there are some specific things that East Granby has done with trainings and things like that to really work to destigmatize mental health. Can you describe that a little bit more?
Well, part of it is just having conversations and outreaches, and so Resilience Grows Here has done a lot of different things to bring the spotlight to the issue, and we've participated with that. So, for example, there's been a conversation in the last couple of years regarding what could happen and what towns could do, and what we need to do. And then there's other conversations that happen where you just get volunteers together. So, for example, we had a community dinner, our first quarterly community dinner in East Granby, where Resilience Grows Here and several other service organizations got together and said, what can we do for the community? What can we have people feel vested in the community? And we had over 200 people come on our first try. And 5-6 different organizations had 25 to 30 volunteers that assisted us. So you're able to get the word out through things like that. In this particular case, it was just a community dinner. It wasn't mental health related directly, but it also provided an opportunity for people to learn more about the different organizations that were there, including Resilience Grows Here. So we also, as we were doing this, of course, the focus of Resilience Grows Here, in my mind, is the veterans. But we also realized, and we've got a very dynamic program that's in our middle and high school. Youth Services started to do some youth action councils for the middle school and for the high school, and it was a natural synergy with Resilience Grows Here.
Absolutely.
And there's just our middle school and high school students did a year of resilience, and so every month there was a new topic to discuss about resilience. So what you do is you just have the conversation. You take away stigma by making it a normal conversation. Yeah. And I think Resilience Grows Here has had success doing that, and certainly East Granby has had success promoting that.
Yeah. To have 200 residents come and support a community dinner, I mean, Linda talked about one of the contributing factors around, mental illness is the social disconnect, and what that provides is another opportunity to provide connection. And when neighbors and community members come together and share a meal, it really is about promoting mental wellness. So even though there wasn't a topic, a theme, any kind of educational component to it, just by virtue of changing a culture in which neighborhoods come back together and have conversation and sit together is supportive of mental wellness.
Absolutely, and part of what I noticed as an observer was that the dinner was over, and there were still 75 people in the community center that were just talking and catching up or finding a new person, a new friend. But I mean, I went by a couple tables and they organized themselves by street. Oh, so this is this is the schoolhouse landing street, and this, so it's the connection that was really important.
It's wonderful, and it was a beautiful event, and hopefully will continue. Linda, we know from research prior to actually initiating the Resilience Grows Here initiative with veterans that they're often most reluctant to seek help, both the active duty and the folks that you work with on the base, as well as our veteran community. Can you tell us a little bit about why you think this is?
Yeah, well, I think that in general, people who opt to serve their country that way have a sense of purpose, have a sense of competence, have a sense of integrity, and they feel strongly that they are protectors and helpers of others, and not the other way around. And if a member should happen to start to feel down or should encounter some heavy stressors, which we certainly put them through, they may start to question some of that identity that they came in with, and it can engender feelings if they already have thoughts about that being of stigma type thoughts, or if they think, well, that's for other people, but not me. I should be able to. That word "should" is always dangerous too. So I think that there's just a sense of independence that our members have that it makes them extremely uncomfortable.
Maybe vulnerable.
And vulnerable, feeling vulnerable, which is not, I would say probably not a typical experience for most of our members.
Right.
Yeah.
When we spent some time talking to the guys at the base, they often identified that they were much more likely to, if they needed help or if they needed to talk to someone, they were much more likely to seek out a friend than they were professional services or clergy or others. And that's one of the component parts of the Resilience Grows Here is
Absolutely.
the peer mentoring and really connecting. Families often bear the burden of, some of these mental health challenges. They often seek assistance or support for their loved ones because they see a side of them at home that maybe others don't see. How is it that a program like Resilience Grows Here can support the family members of our veterans and active duty military?
Well, I think that it's really built into the whole concept of Resilience Grows Here and the idea of developing the resilience in all of our community members, and by bringing, as Jim said, bringing the issue of mental health into the spotlight to whatever degree we can, makes people feel less uncomfortable trying to seek help or trying to get some advice. And between being willing to speak about their concerns and the combination between that and having actual connections, perhaps that you haven't had, that gives a person, kind of two strengths or assets that they didn't have before.
Right. Very good.
Yeah.
Jim, turning to you, as you know, being involved and supportive of the health district for a long time, we really like to focus on prevention. And we know that, to really get in at upstream, we need to be talking about building the resilient attributes of our youth. And you mentioned very briefly in some earlier comments about the SchoolBased Initiative. Can you tell us a little bit more about why you feel that's so important and, what we are trying to do through that program with our youth in East Granby?
It was one of those side effects that we were looking at that all of a sudden it just made so much sense, and we got a huge support from the principal of the high school and the principal of the middle school, because they're the ones that where the rubber meets the road. They're the ones that are dealing with this, and they saw all sorts of complications and issues that students were dealing with and struggling with because of how hyper the world is at this point. And so, stress and strain, am I going to, the typical juvenile stuff that we all did when we were growing up, but things have also, it's on steroids now. Because, you've got the social media, you've got bullying and texting and sexting, and you got all those sorts of things. And we are, a small community. We are with a rural flavor, and that doesn't mean that there's some not sophisticated problems that are out there for our students to deal with. The education folks, professionals, saw the need and immediately grasped that Resilience Grows Here could be a great avenue. We also, at the same time, one of the things of being a de facto member of all committees and commissions in the town is I was able to be a founding member of the steering committee for Resilience Grows Here, but I also was able to work very closely with our educators, but more specifically with our youth services people. And so we were able to bring in some speakers and bring in some programs that were strengthening the message of the Resilience Grows Here. So with just a quick overview, we were able to be very effective.
Yeah, I know certainly the staff of the Farmington Valley Health District have really enjoyed that work and have really seen an amazing outcome in terms of the kids' abilities to articulate what does it mean to be resilient, what are the constructive ways in which we can problem solve, how can we be better communicators, how do we avoid situations where there's conflict, how do we have constructive conversation about differences of opinion, and all of those attributes or resilient skills are things that are protective as we grow and experience life problems that may create mental stresses. So we're very excited to be part of that. Linda, you are doing your work at the 103rd, and we've kind of extended the resiliency training to the folks at the Air Base. Can you talk a little bit about why you think that's so important and how that is supporting the development of skills that really will be protective and support good mental health?
Well, I think that the concept of resilience, that we all have bumps in the road, we all have stressors in life, we can respond in various ways, is counter to the idea of you tough it out, deal with it, suck it up, for lack of a better
staple it back on.
Better word. Yeah, just pull yourself together kind of thing. And actually the Department of Defense itself has a lot of resources and has been investing quite a bit in resilience. So we try to bring those messages very clearly and distinctly to our members, and particularly we work with the student flight to help them to understand that they may encounter things in this new life that they weren't anticipating, and for them to especially maintain their identity aside from being in the military, and to continue to keep those connections and keep a community life as well.
Yeah, I think just the same way these conversations are happening in the broader community by focusing on these resilient attributes within the base, you're also creating that environment that is working to destigmatize the mental health related issues, and while they're being trained to do really tough things, to also address their own self-care and what they need to do to take care of themselves, which is really fantastic. So we know that members of the community often struggle to understand how best they can help people who may be suffering from mental health challenges. I guess I'll start with you, Linda, and then ask Jim, what are some of the suggestions that you have for how is it that the general public can really support people with mental health challenges and promote good mental health within communities?
Mm-hmm. Well, I think that, as we've mentioned several times, that maintaining the connections, the real connections that you have with people, and seeking out new ones as you need, but also before you have a need, I think is really important. I think that being open, I think both as kind of receivers of support and those of us who desire to give support have to be aware that this is a topic that can be on the table. It doesn't have to be hidden. It doesn't have to be stigmatized. I think that's important, and just knowing and making those conversations available to one another.
And easier to have.
Absolutely.
Jim, anything to add from your perspective?
Well, mental health challenges is not a dirty little secret. Mental health challenges are things that can be addressed and worked on, and we need to encourage the atmosphere that allows that to happen.
Great. Well, thank you. Thank you both very much for being here today and for sharing your expertise and your passion for this topic. As discussed, mental health is an important public health challenge for our communities and our veteran population in particular. And working to destigmatize mental illness by engaging more openly about how our life experiences can shape our mental well-being, making the connections to peers and creating environments that support those who may be struggling with mental health can significantly improve mental health and well-being for those living in our communities. Poor mental health, as Jim said, not only impacts the quality of life for the individual, but their families and friends, but it also can have negative impacts on our communities as a whole. These may include unemployment, housing insecurity, increased crime, increased issues with drug and alcohol abuse, negative impacts on educational attainment, and family disruption. So we can all do our part by becoming more informed, supporting those with mental health challenges, and taking good care of our own mental well-being. For more information on Resilience Grows Here, you can go to resiliencegrowshere.org or fvhd.org. Thank you for joining us and watching us, and until the next time, remember, your greatest wealth is your health.